Hey, can everybody hear me okay? Raise your hand if you can hear everything fine. Excellent. All right. Thank you so much for joining us this afternoon. My name is April. I work with Nevro, and I'm the representative for the company for the product that Dr. Gay is about to share with you. Welcome, Dr. Gay. Thank you for joining us. You guys are all muted during this event, but there is a Q&A down at the bottom. And if you have any questions, go ahead and enter those there, and we will address those at the end of the presentation.
Okay, should I share my screen now, April?
Yeah, go ahead.
Okay. Okay, if we're all ready, we'll go ahead and get started. Did you need anything else to say, April, or are we good?
You are good to go.
Excellent. Well, thank you all for taking time out of your afternoon to come and listen to our talk. I think it's a very important topic that a lot of people are not aware about. This is a discussion about a new technology. We're all evolving. The world's evolving. We have digital televisions, digital telephones these days, and a lot of the treatments for pain are the same treatments they've had, since the last 50 years, and have not changed much, even longer than that. So today we're going to talk about a lasting and chronic nerve pain relief that is FDA approved, and it's brought to you by Nevro, and it is a type of spinal cord stimulation or high frequency stimulation, to be very specific. So we'll get into the details of that in just a few minutes, but briefly, an introduction to me. I'm Dr. Christopher Gay of Anchorage, Alaska. Also, we'll be working in other parts of Alaska. So if you need me, I'll be available in a city near you. But I do interventional pain management. I'm board certified anesthesiologist and pain management physician. I've lived in various different places, and from East Coast to West Coast, New York to Alaska. And one thing I found is pain hurts no matter where you are. So we want to give you an option to hopefully get your life back. Give an option to people that have been told there are no other options, or people who frankly don't want to have a big surgery to achieve pain relief. And so in light of that, this is in collaboration with Nevro Corporation. So these materials have been developed in collaboration with them, and we'll get in with some of the things that they have to tell us and some of the technology. At the end, we'll have a chance for questions and answers. Some of them I will be answering for you. Otherwise, we have an expert from Nevro on the line in April, and she'll be able to answer a lot of the company-specific questions for you. But of course, let's start with this premise that living with pain can be very frustrating, and it can keep you from doing things that you love to do. I believe everyone would agree with that. And if you really think back over the past year, there's probably some things you wanted to do that either you could not do or you could not enjoy them to the extent that you wished to enjoy them. Sometimes it's dinners with family, weddings, graduations. Sometimes you think about these events that you have to attend, and you cringe with the thought of having to walk long distances, or just sitting in the car for the ride, or if you have to travel in an airplane, the length of time you have to sit in an airplane, that can kind of sway your decision often. And so we want to address ways that will allow you to get your life back and accomplish some of these goals. Specifically today, we want to cover several things. First, what's causing your pain? And we're going to talk about specifically nerve types of pain. Second, we'll go into some medications and some treatments. Most of you are probably familiar with many of them, probably tried most of them. And then we'll talk about some proven treatments in the way of spinal cord stimulation, and specifically HF10, to treat this chronic, non-surgical low back pain and leg pain. And then we'll provide you with some steps you can take to access this treatment that's available to you and FDA approved. So, two types of pain, really. Now, there's mechanical pain and there's nerve pain. Mechanical pain is quite simply something that hurts because of the mechanics of something aggravating you. For instance, if you stub your toe on the bed, or you go downtown and you trip over a curb and you fall and you break your arm, those things are going to hurt. They should hurt, but those hurts should go away within a few days or a few weeks. If it's something that has to have surgery, then that should resolve as well. You can have some longer versions of those, and those are pains such as arthritis. They may get worse in certain times. Some people can feel the weather changes and things of that nature. And those things may be more durable in terms of how long they last. They may last very long periods of time. Nerve pain, on the other hand, usually comes from damage to nerves. They're nerves that are no longer just reacting to some type of mechanical pain or something that is expected to get better or something that's necessarily expected to cause pain. So they can be damaged, and they can be damaged from a number of different things. You may have diabetes. If you have that long enough, then you start to affect the circulation to the nerves, and you have neuropathic pain that has no mechanical cause. You haven't injured anything or damaged anything physically or mechanically, but you still feel that pain. You also have pain that can come from other things, radiation. You can have pain that is secondary to mechanical issues that have been corrected. So if you have a disc that's pressing on a nerve, that's probably going to hurt. It's going to irritate that nerve. You're going to feel those pains. Sometimes people have had surgery to remove that disc off of the nerve, and they continue to have pain. And that's a type of nerve pain as well. If you have this type of pain, you may have experienced it as burning, tingling, cold, sharp shooting, and it may be associated with numbness and tingling and other sensations. But in general, we think something specific with the nerve for nerve type pain, some type of damage or chronic issue of wear and tear with more of the mechanical pain. So in this particular talk, we're going to be discussing nerve pain because this device and this treatment is very targeted to nerve types of pain. So those sensations that you've been feeling and describing should get a lot better if this treatment works for you. And we'll get into a lot of the details later of how it works and who it might work for. But first, let's talk about how many people have pain, especially nerve pain. So chronic nerve pain is a common problem. About 8% of adults suffer from chronic nerve pain. If you do the math, it comes out to about 21 million people in the United States. So that's a lot of people that are walking around in pain that don't necessarily have to. Some people take medications to help, and for some, they're very effective. Other people do physical therapy, and for those that might be effective. If you combine a lot of these things together, you may be able to have a pretty good quality of life. But there's some people who have done everything and tried everything, and they still suffer from this pain on a daily basis. Common things that are treated. They're used to treat pain. First, you have over-the-counter medications, right? So if you have, a nerve pain, burning sensation, and it's close to the skin, you might actually feel better with some topical things. There's lidocaine patches. There's a number of things you can go and buy at the store or on Amazon, and they might make you feel a little better. Beyond that, you start to get into prescription medications, and you have the common ones. Again, they're anti-inflammatories, NSAIDs. They're nerve pain specific medications such as gabapentin or Lyrica, pregabalin, Cymbalta, number of different medications that it can be prescribed that might help. For some people, they work wonders. For others, they don't quite do the job, and they're still suffering. Another class of medications that has become more problematic, especially in America, are the opioids. We consume the majority of the world's opioid supply to treat pain here. And so that has led to its own problems related to the medication, frustrations such as availability. If you've been to the pharmacy and they say, hey, we don't have your medication, it's on back order, we don't know when we're going to have it again, that can be frustrating as well. And so even if it does work for you, which, in general is not considered the best treatment for long-term pain and specifically nerve pain, but in those cases that it does provide some relief, you still run into some frustrations related to these medications, as well as inconveniences in terms of the requirements around these controlled substances, whether you have to go in to do urine screens or whether you have to, have certain appointments in office with more regularity because you need to be seen to document how these are doing and keep good records for the controlled substances. Physical therapy, that helps quite a bit, especially with mechanical pain, right? So if you have arthritis, if you can strengthen the muscles, around that joint, you can take some of the stress off that joint, and it may actually feel better. Physical therapy sometimes can decompress a nerve. If there's something pressing on a nerve, it might be able to, again, strengthen some of the surrounding muscles to take some of the pressure off of that nerve, and it may not irritate you as frequently or as much. And again, these are beginning things. Most of you probably check these boxes, and you can explain these just as well as I can because you've been through it, and you've been through it multiple times. That gets us onto injections as well, and that's what we do frequently to try to put out those fires that are causing the pain. So if a disc is rubbing on a nerve, the nerve may get irritated, and then the nerve starts to swell. It gets larger in size, and then it gets more closer to that disc, and it's more easily irritated because the disc is touching it more frequently. So often we'll use like steroid-based injections, which are very strong anti-inflammatories, to try to calm down that irritation. Hopefully the nerve can shrink back down to a size where it is not as easily irritated. At times, injections stop working or guidelines may change. For instance, Medicare previously allowed 6 epidural steroid injections per year, but now they're down to 4. So if you're in the category where you were feeling pretty good, every 2 months or so, you might get an injection. And of course, you're monitoring your medical status, making sure your blood sugar and other, hormones and things that can be affected in the body aren't being adversely affected. You can sometimes extend those out and get a pretty decent quality of life. Cutting down to 4, there's some people that are going to be suffering quite a bit. And that group of people may be looking for other options. Again, this may be an option for you. And you can come in and have an evaluation and see if it's something that might actually work for you, or some other treatment that helps with the same types of symptoms that you might experience from this type of nerve pain. Other people may or may not have had surgery. They may or may not be a candidate for surgery. So you can have an evaluation with a surgeon, and they may say, we don't think this is something that's going to improve, or maybe you had back surgery and maybe you did great at first, maybe you never did great, but now you're starting to have these same symptoms shooting down the leg. Maybe you visited the surgeon again and they got some imaging and said, hey, my job is done here. We've decompressed it. We've taken everything off of that nerve. There's nothing pressing on the nerve. It should not be hurting. And you say, tell the nerve that, because it does hurt. And so there are ways that we can address that nerve when everything else has failed. This is another, path to potentially try and see if we can achieve relief. So this is for people who don't want surgery and people who have tried surgery and it has not helped them. Let's get back to the medications. Opioids. Everyone's heard of opioids, Percocet, hydrocodone, OxyContin, those things. And those things are addictive at the very least. So they're not medications that you would like to rely on. And for many years throughout the course of history, we've pretty much gotten by without the presence of these medications. Now we have another option, and many places people don't have that many options, and that's where this type of treatment comes in. You can be referred in for evaluation. Sometimes with telehealth, we can even remotely evaluate and hopefully figure out most of the things before you even have to come to the office, or whether you might be a candidate or maybe it's worth you coming in from somewhere that's more remote. But providers often trying to be helpful. No one wants to send someone home in pain, may write a prescription for an opiate and you might feel better temporarily. But as anyone that's taken these knows, for the most part, people feel good a little while later. It's not as feeling as good. They take a little more, and eventually the medications aren't helping very much at all. And, it's quite interesting when people come in and they say, what is your pain level? Oh, it's 10 out of 10. And like, what is it when you take a medication? Oh, it's still 10 out of 10 or 9 out of 10. I was like, it's not doing very much for you. It's doing nothing but giving you potential side effects. And it's not just the, extreme side effects that you hear about where you stop breathing or have respiratory depression. But there are other things. They can affect hormone levels. For males that are on long-term opioids, your testosterone levels drop, and that also decreases your muscle mass, which makes it harder to exercise, harder to take pressure off these joints. And you go into physical therapy, it's not as effective. So there's a cascade or trickle down effect of taking opioids that it may potentially solve a short-term problem, but it may create a whole long list of larger problems down the road. So it's not generally recommended. You may take it and, find that it helps you some, but just keep in mind there are other options that you can get to before you get to this point, or if you're on opioids, other options to keep you from increasing your dose, or maybe even allow you to decrease or get off them. So if you want to be able to get your life back and travel and not have to worry about being in town for your prescription refill date and all that stuff, it's something you should consider. Furthermore, there's a lot of people taking, opioids. The number that die per year, there's about 1 in 500 who are on long-term opioid treatment. 1 in 3 patients says abuse or misuse their opioid prescription. That's a broad statement. I won't harp on that, but this comes from the CDC's website. You can certainly go there and read more about how they arrived at these numbers. But what I really want to focus on now, in the rest of this talk, and leave some time for you to ask questions, is the FDA-approved treatment, which is not a medication, not a drug. We're moving to a digital age. This is essentially a digital treatment for pain, right? We have digital solutions for everything else. We have digital solutions for mail. We used to have to, send things to the Pony Express, and then we got the post office, and then we got vehicles, and then you got FedEx, and then we have email and other things where you can send things electronically. So even online, you can educate yourself. You can learn about just about anything online. When I was growing up in school, we had a textbook for every class. Now the kids get iPads and Chromebooks, and they rarely have a book. So we're moving into a digital age in pretty much all aspects of our life. with the exception of treating our pain. So why don't we move on to the modern ages and move out of the past and embrace this option? So you may be wondering, what is spinal cord stimulation? And I'm glad you asked. So it is a method to treat pain without these addicting painkillers, or hopefully to reduce the reliance on those. And we're doing a very targeted treatment, right? So if you take an anti-inflammatory, if you take Celebrex or ibuprofen or something of that nature, it goes all over the body. Your little toe gets just as much as your nerve pain shooting down your leg, right? So this is going to be targeted because we're targeting the pathways that transmit the pain to your brain. So when they say, hey, the pain's in your head, it is in your head because that's where you recognize it at. So we're gonna target those pathways and prevent it from going to your head or coming back down and being expressed as sensations that you feel in your extremities, legs or arms, etc. So the way we do that is we send these tiny little electrical impulses to change how your body processes the pain. It is similar but different to a pacemaker, where the heart is doing something it's not supposed to do, and you want to correct that. In that case, they're taking over the rhythm of the heart. In this case, these nerves often are doing something they're not supposed to do, where they're sending signals to the brain saying, I hurt, I hurt. And in some cases, especially like if you had surgery, you're not really hurting. These nerves have just gotten sensitized, So this is going to take over those pathways. And, essentially, if you watch, Star Wars, it's going to use the force. So you do not hurt. And when those signals get to the brain says, I do not hurt. And so in the past, this device used to have signals that would be generated that were hopefully more pleasant than what you feel from the device, from your normal pain. And so you'd feel a buzzing, tingling sensation. You may know people that have tried those, even have those types of systems, and they may complain of that. I've even had someone who had a device in the past, tried a device, pain went away 100%, but they said they felt like a motor was running in their body overnight and they did not want it. They'd rather stick with the pain. Fortunately, times have changed and things have evolved. And the devices now have settings where you don't really feel the stimulation at all. It just works on those pain pathways and makes them go away. So historically, this technology has been around for about 50 years. Right now, there's about 34,000 patients that undergo these procedures worldwide, all over the world. So not just in the US, Europe, you name it. Everyone has access to these different indications depending on what country you live in, but it's pretty universal that's used for pain. System, there's several parts of the trial, but it's one of the few things. I think there was a late night television commercial for maybe the Ronco oven, and they said you get to try it before you buy it. It's the same thing here, where it is a permanent device that can get placed in your body if you like it. But fortunately, to figure out if you like it, we can put a temporary one in. And this temporary one, it could consist of two little small wires, smaller than strings of spaghetti, or approximately the same size. They go in, we put that in for about a week. And then after that week, you come back, we take those out and we put on a Band-Aid. So it's not a big procedure to do the trial. You don't have any general anesthesia during the trial. And you come back and you tell me, this made my life amazing. I can't imagine life without this. I don't know where this has been. And so it's fairly simple to do that. You have to qualify for it. Most insurance companies, there's a few steps you have to go through, a few things you have to prove that you've tried. And again, most of you have been there, done that, tried all these things, and you got the t-shirt, you actually probably sell the t-shirt, sell to people. But you do those things and you come back and you try it. And if you like it, we get you set up for a permanent one. If you don't like it, that's the end of that. There's no downtime. You're going home and taking that shower that you wanted to take all week, because it is a device that enters your body from the outside and goes all the way deep in. You don't shower while it's in. But that's usually a worthy trade-off for people, especially if you get a lot of pain relief. Again, there's two different types of signals they can give you. You can still give you the signal where you feel something. Some people like to feel something. When the pain increases, they like, I want to feel something, that feels like it's doing something. So they can turn it up and feel, pulsating or different frequencies, and April's a master at shaping those and kind of giving you some programs you can feel. And she can speak more to that if you'd like to do that. And also, if you just have more questions after we finish today, certainly call April, and she can tell you everything you want to know, connect you with more patients that have had these or have these. I will say, actually, I believe the first patient that ever got this device still has their device, still using the same one, and it's still working for them. So it is a good therapy, and kind of like fine wine, it gets better with time. All right, again, originally approved back in 2015. So again, the first patient's knocking on 9 years. I believe the trial patient, the first one, I think, was 2012. I could be wrong. But to date, there's been over 100,000 patients that have been treated with this particular therapy. and it's shown to provide significantly better pain relief to more patients than the traditional settings. Again, that's the one where you feel something that hopefully replaces your pain with something that's more pleasant. With this setting where you don't feel anything, a lot more people are feeling better. So look at the numbers to the right of your screen, and this shows a percentage of patients with back and leg pain that had significant relief. Of those in the HF10 or the Nevro type therapy, about 70%, 76% felt better. This is comparing it to traditional stimulation, and that's not saying that every other company uses, the traditional therapy. A lot of them have these options, but compared to traditional therapy with just the pulsations and the sensations, only about 49% of people reported significant pain relief in their back and their legs. So it's clinically proven for patients who, are not a candidate for surgery. So either you don't need surgery or you don't want to have surgery, but you have this nerve pain that's not responding to anything else. So by these numbers, about 8 out of 10 people had significant long-term relief. Okay, and that's at 12 months. So the average pain score, if we were floating around a 7.4, there's some people that were higher, some people that were lower, ended up with an average of about 2 on a scale of 0 to 10. So that's something to talk about, right? The beauty of it is that especially compared to opioids, it doesn't have any, overarching, I guess, effects on other parts of your life. You can drive, if you have the opioids and medications such as that can cause sedation, you don't really want to get behind the wheel of a car. So this gives you more freedom in that respect. Sleeping and things of that nature, you're not worried about it interfering with your sleep apnea and causing you to have respiratory depression and, not being able to breathe or waking up with some type of other complication because of low oxygen saturation at night. Again, you use the HF10 setting. There's no uncomfortable stimulation. The charging is very easy and convenient. It doesn't take very long to do it. The battery life is about 10 years. So again, with the trial, there's just the 2 little leads that go in, and there's an external battery that you have during the trial. If you like it and get a permanent one, that battery is placed under the skin. Again, kind of like a pacemaker, except it's in your lower back instead of on your chest. Those batteries do have to be changed. They take about 10 years before they deplete it and need to be replaced with a new battery. And even at that point, it's usually a very simple procedure where you just open up the battery pouch, take out that battery, connect it to a new one, and close that back up. It's not a whole new procedure. You're not opening up your back or anything like that to change that part of the hardware. Again, it's a very smooth, comfortable sensation. You're not getting tingling and prickly. So to say that this is successful, even during the trial, we want to see at least a 50% reduction in pain or a 50% improvement in function. So you can tell me the things I couldn't do before, now I can do them for longer. I can walk to my mailbox, or I was able to go to graduation or sit on an airplane. So you want to see improvement in function and ideally a reduction in pain. And so you can think about how your life would be different if whatever your pain score has been on average, cut that in half and think about that. And it may be better than that, but that's the minimum that we look for. Again, talking about try it before you buy it, right? So we put in a temporary one. We put in 2 leads, just one usually on each side to cover, both sides around the spinal cord. And it sits on the back side of the spinal cord. It doesn't go into the spinal cord. It doesn't press on the nerve or anything like that. But to screen that, we'll usually have an MRI even of the thoracic spine, which is the part between your neck and where your ribs end, just to make sure there's enough space in there. It's not very common that people have a lot of narrowing in that part of your back, but we want to make sure we don't put the device in and then you have, a new issue because there's just not enough space. And now this is pressing on something. So again, vast majority of people have no issues with that. We can implant the temporary. This is what it kind of looks like. You have the little thin wires that are running in, secured down, and they go inside the back and they're attached to this temporary battery pack here. And you go on with that for about a week. And again, we want you to keep that dry so it doesn't get wet. So little bacteria decides to take this interstate superhighway up and take a trip into your spinal canal because we don't like infections. Right. So who is a good candidate? Again, we have in the past, you really only could have mechanical related or, physical nerve pain from a disc pressing on it or something like that. Something that started in that realm and it had to cause pain down the leg. Recently, we've gotten FDA approvals for the chronic pain and as well as the leg pain. And then also for pain that is non-surgical. Previously, you had to have had surgery and failed it. Now it's not a requirement that you have surgery. So if you have something and it is amenable to this treatment, you may be a good candidate for it. Of course, every insurance is different. They have different guidelines, and for some people, there's an authorization process to find out whether you're going to be a good candidate or not. But typically, universally, all of them are going to require you to have tried certain medications, probably have done physical therapy recently, not 10 years ago, tried injections. A lot of these injections that you may have tried, especially if they've been a while, they may actually work now for different reasons. And your pain condition sometimes progresses, and it may be that a treatment that was tried before is actually effective now. So you want to do the simplest thing. I wouldn't say as soon as you have back pain to run here, back or leg pain to run and ask for a stimulator. But again, if you've been diligently trying these things, doing the home exercises from physical therapy, you tried the medications, maybe you have side effects, maybe they didn't help. Maybe you just don't like taking medications. Maybe you travel a lot and you can't think of doing these things. Physical therapy hasn't helped you or isn't convenient to do again and again and again. Then you can come in and have an evaluation, and we can submit to your insurer, whoever that may be, to see if they will allow you to have a trial. So next steps, if you would like to have an evaluation, we would like to ideally to have a recent MRI. And if you don't have one, we can order that at your visit when you come to see us, assuming it is indicated and your symptoms match up. But I'll leave the numbers on the screen, and you can either call us at 907-339-4800. And be sure to mention that you're calling after seeing this webinar on the Nevro HF10 or stimulation device. Or you can send us an email at info@painlessalaska.com. And you'd come in and we'd evaluate, and we'll discuss what treatment plan we might recommend. Again, it may be some things you've tried in the past. If they've been too far in the past, it might be physical therapy. It might be injections. It might be certain medications, because they may have come out with some new medications since you last had an evaluation. But overall, we want to find the best plan for you to help you get back your quality of life and do the things that you enjoy doing. This is the fast attorney speak stuff that I'm not going to attempt to read, but it'll be available for you. It's all also on the website. If you go to nevro.com, all this information that we talked about will be there. And I will open up the floor for any questions that you may have.